Hi, my name is Marie Duggan and I am here as part of the FHT Stay at Home programme. I created the accredited CPD Cancer Care Workshop in 2013. Due to the demand from my face-to-face workshop, I further developed my training into an e-learning offering. It is now an internationally accredited CPD training and known as complementary therapies in cancer care for massage, reflexology and Reiki practitioners. The course was launched in 2019. Today, I'm going to give you an introduction into adapting your therapies for cancer care. What we are going to cover is, what are we treating? Benefits of complementary therapies in cancer care, and there are many. Who can we treat and when? Considerations when treating a patient with cancer. We're going to look at how to adapt your treatments and working in a private practice or a medical setting. What are we treating? Before I talk about what we are treating and to give some perspective to what we are treating, I think it's important to be aware that there are over 200 different types of cancer, with oncologists specialising in many areas of these. We, as complementary therapists, are not treating cancer. This is not our area of specialism. That is the role of conventional medicine. Complementary therapies are our area of expertise. We learn the importance of harmonising the mind, body and soul, and how to calm and balance a system. Through our expertise, we facilitate deep relaxation and stillness. Our role within cancer care is to support the patient through their treatments using our skills. Just imagine what a gift this is to a traumatised mind and body. What we are treating. In order to tailor our treatments, I feel it is important to have an awareness of just some of the emotions our patients may be experiencing. We are often dealing with patients in shock. Like many of us do, our patients may have attended a routine health check to find that they're being told they have a cancer and their world has just been rocked. They are in shock. The patient can be completely overwhelmed. Yesterday, their life was organised with social and work plans, and today they are looking at many dates, scheduling blood tests, scans, oncology appointments, and they are facing decisions about potential surgery, chemotherapy or radiotherapy, and their world has literally been turned upside down. We're also treating at times anger. Some patients will come in and be actually quite angry at themselves because they've maybe ignored health signs and warnings, and now they find themselves with an advanced cancer. Patients can at times be angry if they feel their concerns were ignored and not acted upon. With the prospect of a possible life-limiting condition, patients can feel sadness, and at times we may have patients who are depressed. Of course, the patients may already be depressed, and now they have the added worry of a cancer diagnosis. Fear is often in the heart and the mind of many patients. We know ourselves when we think about a cancer diagnosis, it can create a flutter of fear deep within us. Well, for some patients, fear does not flutter, it rages through their system, which can paralyse their mind and prevent them from accessing any possibility or vision for their future. Patients can also feel very isolated and alone. no matter how many people they have around them. This is something I feel we can all now relate to through COVID-19. All around the world, we have suddenly been thrust into uncertainty and isolation. We cannot freely see the people we love and do the things we love because we need to prevent becoming infected. This is something patients going through cancer treatments experience for periods of time. Our therapies integrate a soothing, caring touch, supporting the patient during their cancer treatments. We enhance the patient's quality of life. Using massage, reflexology or Reiki techniques, we help to reduce stress and assist in alleviating anxiety. And through our treatments, we facilitate stillness. We provide invaluable me time for the patient. Our purpose is to treat the whole person. To sum this all up, we help to reduce stress, assist in alleviating anxiety, and we improve quality of life. This is no small thing. We play an important role in a patient's cancer journey. Benefits for patients are many. Our treatments counterbalance the effects of stress. They encourage deeper and easier breathing. When I treated patients with lung cancer, I particularly noticed a difference in the ease of their breathing. Often, I would hear the patient waiting at the other side of the room, coughing incessantly before coming in for their treatment. Once the patient was appropriately positioned and comfortable, I would begin. And within 5 minutes, their breathing would slow and their coughing would ease. So much so that upon leaving, carers waiting would often say, "Oh my goodness, you stopped coughing." And they would notice this. But they'd be so delighted to see that relaxation had helped with this. How wonderful is that? Massage and reflexology improve joint flexibility and circulation. Through relaxing the muscles and nerve fibres, we often ease pain. And by providing gentle relaxation, we facilitate stillness. We help boost the immune system by calming adrenals and releasing endorphins. I'm going to come back to giving that patient that very important me time. That time is purely for them, about them. Our treatments can help patients access a more positive approach, or at times acceptance. We can help with depression by inducing better sleep. Most patients will sleep at some point in our treatments, but more often they would report back that they had had the best night's sleep they'd had in ages. And you've got to remember that often patients are going through treatments, they may be receiving steroids, and when they receive the steroids, that actually makes them much more hyperactive, and sleep is quite difficult. We create an environment where patients can express views, fears, and tears if they need to. We also help to relax the patient, making chemotherapy easier. We would often be sent patients from the chemotherapy department, desperately in need of relaxation. Due to high levels of anxiety and stress, the chemotherapy could not be administered. After receiving a relaxing therapy, patients returned and had the chemotherapy cannula inserted so that they could complete their treatment plan. Patients recognised themselves how relaxation helped with this process, and often then made appointments prior to receiving their chemotherapy to come for our treatments. It worked really well. Before starting my treatments, a technique I often used, especially with patients who were so very, very stressed, before I even put them in a position and laid them down and was ready to deliver the treatments, I would actually use a stress ball. Now, would you believe I can't find my stress ball? So I'm just going to talk you through this. I do have a little example, but it's a little baby foot, but it actually is also a stress ball. So we can scrunch it up and use it as a stress ball. But stress balls have been sold for quite a few years now, and often they're quite seen as maybe a bit of a gimmicky present. But as we know in reflexology, stress balls are being applied directly to the solar plexus. And so what I would do is rather than lay a patient down, I would get them to sit down, and then I would ask them and put a stress ball into the hand. And I'd explain this to them. I'd explain that what we're doing is we are accessing the solar plexus in your hand. So quite often by doing this, the patient, just imagine it's a ball, the patient would actually put the stress ball in this hand, and then they would access their solar plexus. And I would lower their hand onto their laps. And as they were doing that, I would then take their other hand. And then in turn, just put this down, in turn I would then bring my hands down and I would apply pressure in the third zone to either side of the hand. So as the patient was receiving stress relief direct to the solar plexus on one hand, they were receiving it from me on the other hand. And we'd spend at times, sometimes, maybe 5 minutes just sitting and doing that and calming the system down. It was very effective, so much so that the patients, we were actually empowering the patient in their own stress and relaxation cycle. And I would often give the patient the actual stress balls, and they would then take those to the chemotherapy session with them and sit there and use them before they receive their treatments. It's a very simple technique, but extremely effective, and it helped before I even got down to putting my hands on and doing a therapy treatment. Through the touch, we help patients get back in touch with their own bodies. And we can empower patients through self-treatments, such as using stress balls and those kind of techniques. We have so many techniques to our fingertips to teach patients. And this could be down to very, very gentle, very light hand massages. It could be a very gentle foot massage. We could teach a carer to do. Just simple effleurage. It's all soothing. Breath work, meditation, we could introduce visualization, and the list goes on. So when we consider who we can treat, by using specific adapted techniques, we can tailor our treatments to the individual patient. By adapting our treatments, there is always something we can do to treat patients at all stages of cancer. Our treatments will become lighter and gentler as the patient progresses through their cancer treatments. And at times, this may even be a holding touch. Our approach and treatments need to be flexible and adaptable. And at times, be aware that a 15-minute adapted treatment is perfect for a specific patient. So considerations for treating cancer patients, we do need to know what the diagnosis is. Although we are not treating cancer, we do need to know what and where the cancer is in order to consider any contraindications. We can adapt our pressure, the time of the treatment, or even the suitability of the treatment being provided. I have treated patients who have asked for massage initially, and then because of surgery, I've delivered reflexology, and then felt that Reiki was more appropriate. Each therapy is perfect for treating patients going through cancer treatments, and we can tailor and create a therapy blend unique for each individual patient. At what stage is your patient in their treatment? This is a question you need to ask at the beginning of every single session. Are they pro-surgery, pre-surgery? Are they receiving radiotherapy or chemotherapy? Where are they in the cycle of these treatments? All of these considerations will dictate when and how we deliver our treatments. Is your patient in need of extra professional support? If you recognise this, refer them on. Counselling and hypnotherapy work beautifully alongside all of our treatments, but they also work beautifully independent of them too. Know your limitations. Do not offer advice on nutrition or skincare unless you are appropriately qualified to do so and actually employed to do so. Be aware of the guidelines and protocols. Who do you reach out to for support? We all need support, especially in this area. It's a very, very rewarding working in this area. It's very heartfelt work, but we need support too. Can you access peer support, mentoring, or supervision? Reach out and ask for it. Have you received specific training into the guidelines, protocols, and contraindications to treat patients with cancer? When we consider adapting our treatments, again, I'm going to come back to we need to be adaptable and flexible in our approach. And this could mean positioning your patient very carefully and making them very comfortable. I know we do this with all clients, patients, but we are taught to position clients in a specific way and deliver our treatments. However, if we are delivering a treatment with patients in bed, they could be in a fetal position with their knees drawn towards the abdomen. We're not going to move them. So we're going to do what we can. We're going to be adaptable and flexible. And that might mean that we will just access one foot and maybe a hand, or two hands and one foot and one leg. We're going to work within what the comfortable position the patient is in. We're not going to expect the patient to move. In these cases, we are treating individually a patient. If a patient has lung cancer, we would elevate them to whatever point that they are most comfortable. And this actually at times might be very upright, they might be completely upright. If you have a patient with bone cancer, you would need to be aware that patients may need to move often and reposition. Use pillows wherever they are needed. Position them between the legs. It could be underneath the hips. But importantly, give the patient permission to move. Let them know you are going to be watching them carefully. You are looking for any signs of discomfort. And if they do need to move, they could simply raise one finger to let you know. Pillows are very important, so make sure you have plenty ready. Due to the position of your patient, you may only be able to access certain parts of the body, and your treatment time will be shorter. But that's fine. That will still work wonderfully for that patient. In adapting your treatments, we also have to consider what is the appropriate pressure for patients with a compromised immune system. Well, this is a tricky one, isn't it? And I spent quite some time considering how to demonstrate this and make it so that we all have a clear idea of what this pressure is. After all, we're all taught in different massage and reflexology methods and styles. And what often is a light pressure to one person is a deep pressure to the other. The answer proved quite simple, as often these things do, and came to me while I was out on my weekly shop. I saw this baby sponge. Here we are. And it kind of just made me think a little minute, and I thought, that's worth trying. So I bought it and I tested it out as an experiment. I tried this method in my face-to-face cancer care workshop, and all the therapists there, which consisted of massage, reflexology and Reiki practitioners, assured me this gave them a unified example. Everybody understood what I was saying, and we all got the message. So, as you can see, it's a baby sponge. It sits into the palm of my hand, and it's very soft. And you can buy these very easily. They're very inexpensive. So, as an example, I'm going to move it over. Take your middle finger and thumb. Place them into the middle of the sponge. So, we're now going to depress, and we're going to bring your thumb and finger to meet in the middle of the sponge. Hold it and release. We'll just do that again. So we've got the middle finger and the thumb into the middle of the sponge. We're going to depress all the way in. The thumb and the finger are meeting between the sponge, and then we're going to release. Now, this is an average pressure. It's not too deep, but one we can generally use for many clients. This time, I'd like you to take the sponge, and this time, instead of the middle, I want you to go to the outer parts of the sponge. Here we are. I'm just going to try and make sure you can actually see what I'm doing. So, we're now going to take it to the outer. And this time, we're going to depress with our finger and our thumb by about 1 centimetre. We are not meeting in the middle. Relax it and return. So I'm going to do it again. Depress by approximately 1 centimetre and return. Okay, so this is a very gentle pressure and holding, and it's appropriate for patients with a compromised immune system, working in a private practice or a medical setting. When we're working within a medical setting, we tend to have, more often than not, the support of a clinical or a complementary therapy lead. So we have a team around us offering support and guidance. Working in a private practice more often than not means that you are working alone. So my recommendation is reach out to established services. Introduce yourself. Create a package with your qualifications and your experience, your professional status and insurance, and leave it with them. Let them know what it is you're offering. Considering setting up a service, reach out again to established services. They may be wanting to expand and extend their services. And I would also say join business clubs. This is not necessarily purely in holistic or the complementary therapy health field. However, they tend to be aware of current funding, and you may fall into a particular niche to access it. It is a lot of legwork and networking, but it is worth exploring. Insurance. Does your insurance cover you for cancer care? Have you received the appropriate training? And if you have, is it time to refresh and update? We would always adhere to recommended guidelines, protocols and best practices. Always get written consent on your first appointment with any new patient or client, followed by verbal consent thereafter. Keep good record keeping, sign and date after every session, and be vigilant about confidentiality. Well, it's time to bring the session to a close. Thank you for taking the time to listen to this short introduction into adapting our therapies for cancer care. I hope it has helped you see the relief and benefits we bring to a patient's system when they are going through cancer, surgery, chemotherapy or radiotherapy. Please take some time to reflect and consider some of the points in this presentation and answer the following questions. Number 1, what are we treating? Number 2, name 3 areas our therapies help in. Number 3, name 3 ways we can adapt our treatments. For further information on training in cancer care, please visit butterflytouchtherapies.com or message me at marie@butterflytouchtherapies.com. Do not underestimate the power of your touch and the strength in your gentleness. Keep well and safe. Thank you for your time.